تصحى وبيجود لنا في حاجات كده جه حصل وبيجود لنا في حاجات وكمان بودي لنا ابديت كتير. دكتورة باسكوالي في معنا في ذاك الاستوديو هسه وفي تغيير في برنامج تنا شوية. لكن بس قبل في ناس انا ما اقرا الرسائل تومون كده نشوفوا الرسائل دي عشان بعد ذاك انا ببدا اشيلوا تليفون تكون كمان انا بونس وما ديف من ذاك الاستوديو يلا بعد ذاك كمان كان في فرصة زول عنده سؤال كمان بيقدر يسألوا بعدين لديف تاي في ذاك الاستوديو. معلش لتغير البرنامج لكن ده مهم توضيح من وزارة الصحة.
Good morning, it's iRadio.
Yeah, as I said, let me look at some of your messages that dropped in. I have, yes, this is Kim Jaye. He's saying, good morning, Mama Helen. I greet you and I radio listeners. I'm watching live from One Joke, Northern Bahar Al Ghazal. Our station is okay and nothing bad. And James Garangdale is saying, good morning, Mama Helen. I greet you and I radio listeners. I'm watching live from Chuebet County, Lexus State. Our situation is also okay. And as I say, ممكن ترسل رسائل. أنا بقرا جزء من رسائل وبعد ذاك أنا كمان بقى بخش في برنامج مع ديف تاي من وزارة بتاع الصحة بعد شوية. يس كان في ناس رسلوا رسائل من الصباح أنا ما أقرأ وياهو هانا جيرجا في رسائل تومان في بول ماين. He's saying, hello Mama Hellen Samuel, good morning. I'm watching you live from Awil, South County, Northern Bahar Al Ghazal State. And the thick thin Dopulo is saying, good morning. I radio CM1E is saying, good morning Mama Hellen Samuel. Wani Loki then watching you live at Jopa residential area here in my area. Everything is fine, not bad. Yeah, these are people reporting about their situation during the resident report. And then we have Makwai Deng Ajong. He's saying, hello, how are you? I'm fine there and I hope you're fine too. Then yes, let me look at more of your Bolongara Long is saying, good morning Mama, I'm watching you live from Mading Awil, America Teen. Wow, that's a bit strange, but yes, that's what he wrote. And yes, Aganyi saying, good morning Mama Helen. I think I got this message earlier on. And Leth Mangara Doth, Leth is saying map for pitch a Marco Leth Mangar a Chuot watching live from Rumbek together with the map Porika. Good morning to you. And Akot Lali, yeah, is saying just good morning. Yeah, keep your messages coming and we will start our program in a while with updates from the Ministry of Health. Now itakuwa mungkin bistemira rasul rasail takun washana بعد شوية النبي بدأ برنامجنا على سبب اللي عندنا وزير من وزارة بتاع الصحة في ذاك الاستوديو.
صوتك مهم أكتر ما تتصور. في كل مرة بتتصل فيه بإذاعة آي راديو، في كل مرة بتشارك فيه وجهة نظرك، وفي كل مرة بتدلي فيه رأيك على الحوار. انت بتمارس حرية التعبير، انت بتحمي حرية الإعلام، انت بتحافظ على حيوية الإذاعة المستقلة، وانت بتشارك بفعالية في عملية الحوكمة. كثير من الناس ما بيعرفوا، لكن الاتصالات والتعليقات والمحادثات دي ما مجرد كلام، بل هي أفعال مشاركة عامة، نبض مجتمع حر ومنفتح. بالتحدث انت بتساهم في محاسبة القادة وإثارة قضايا المجتمع وتشكيل الحوارات الوطنية. بدون صوتك بيصمت الميكروفون. استمر في الاتصال، استمر في الكلام، لأنه لما نتكلم الشعب بتتنفس الديمقراطية.
Your voice matters more than you know. Every time you call iRadio, every time you share your perspective, every time you give your opinion on air, you are practicing freedom of speech. You are protecting media freedom. You are keeping independent radio alive. You are actively participating in the governance process. Many may not realize it, but those calls, comments, and conversations are not just talk. They are acts of public participation, the heartbeat of a free and open society. By speaking up, you help hold leaders accountable, raise community issues, and shape national conversations. Without your voice, the microphone goes silent. Keep calling, keep talking, because when the people speak, democracy breathes.
It's the break of a new dawn, and this is the Dawn on iRadio.
Looking for the perfect radio partner? iRadio is your answer. Why choose iRadio? Here are the 5 compiling reasons.
Trust and reach. iRadio stands as the most trusted and popular radio station in South Sudan. Backed by recent surveys with a loyal listener base, your message will reach a wide audience effectively.
Extensive network. iRadio is not just a radio station. It's a network of interconnected stations. When you partner with iRadio, we'll broadcast your program across multiple locations such as Wow, Awil, Kwajob, Yambio, Bor, Rang, Malakal, and Baliet, ensuring maximum coverage and impact.
Regional presence. iRadio footprint extends to the states of Western and Northern Bahar Ghazal, Western and Central Equatoria, Jonglei, Upper Nile, and Warab. By collaborating with iRadio, you can connect with diverse communities and target audiences in these regions.
Community engagement. Partnering with iRadio means engaging with communities at a grassroots levels. Your message will resonate with listeners in various locations, fostering meaningful interactions and driving brand awareness.
Comprehensive coverage with stations in strategic locations like Reng, Malakal, and Baliet. iRadio offers comprehensive coverage that reaches both urban centers and remote areas. Your partnership with iRadio ensures visibility across a wide geographic area.
Don't miss out on the opportunity to amplify your message with iRadio. Partner or advertise with us today and make your voice heard across South Sudan. This is iRadio.
Yes, now we are starting our program right away with my guest in the studio. So joining us today on iRadio is Dr. Harriet Pasquale, the Director General for International Health and Coordination at the National Ministry of Health. We are discussing a critical concern development concerning development in the health sector. The ministry's recent announcement to terminate support for over 100 health facilities and downgrade several hospitals across the country due to a significant funding gap in the World Bank supported health sector transformation project. Dr. Harriet, thank you so much for joining us to shed more light on how the ministry plans to navigate the transition and what it means for the millions of South Sudanese who rely on these services. Thank you so much for coming, Doctor.
Yeah, thank you, Mama Helen, and good morning to all the listeners. Thank you for having me for this talk show.
Yeah. So now maybe you can start by clarifying why you are here in the studio so that the listeners or the followers could also be able to have tangible information to move forward, because, you know, such informations can shake people and they start wondering. Yeah, welcome.
Yeah.
You can use both languages, whichever you are comfortable with.
Okay, thank you once again. Today I'm here to talk about the flagship health project in the country, which is the Health Sector Transformation Project. In 2024, the Ministry of Health and its partners and donors sat together and agreed to implement a project which was named as the Health Sector Transformation Project. So the Health Sector Transformation Project is a health project which is supported through a multi-donor trust fund, which is the World Bank. So it includes the World Bank and a consortium of other donors. We have the UK, we have the EU. There is the so we have UK, we have the EU, we have we also have the Canadians. In the beginning of the project, the U.S. and the Norwegian government was also included as part of the donors. So this was supposed to be a 3 years project running from 2024 to 2027. But during the implementation period, some donors also, due to the current cut of aids around the country because of the global changes in priorities to funding, so we lost 2 donors, which is the U.S. government and the Norway. So, but currently, as I speak, we still have the World Bank and the consortium of other donors supporting this project. So this was a 3 years project, and it was planned to support health service delivery. And the main focus was really to focus on maternal child health and also support to vulnerable population across the country. So it's a project planned to support initially 1,158 health facility. So during the course of the planning and also the initial phase of the implementation, we were not able to have sufficient funding. So from 1,158, we dropped to 816 health facilities. So over the past years, the past 1 year, we managed to implement successfully the health sector transformation project in 816 health facilities. As of December 2025, we also observed that we still had a shortage of funding because, of course, of the changes in the global priorities, so we are not able to have sufficient funding. This called for an extensive review of the project, so we conducted a review and we looked across the project areas to see areas of saving so that we can be able to continue the health service provision with the available funding. This review resulted to a reduction in a number of project areas in order to have efficiency gains. So one, of course, was the reduction in the supported health facilities. So from 816 health facilities, we reduced to 714 health facilities. So a reduction by 102 health facilities. And then we had 6 health facilities, which are mainly hospitals, that we reduced the level of support. So if we were these hospitals, instead of supporting them at a hospital level, we reduced it to be supported at a, if it's a tertiary, we reduced to a state level or a primary health care support level. So the level of support reduced in 6 health facilities. So that was not only the main cost saving area we managed to find. We also looked through across the project area. We were able to reduce also in the incentive payment, because this health sector transformation project used to pay incentives for all the 816 health facilities. So in addition, we also looked through and we said, okay, in order to have savings, because we were looking for savings of about 18.7 million that will be able to, to allow us to continue to provide services for this year. So we also went ahead and we reduced the rate of payment for incentives. And we also looked through the implementing partner cost. We also reduced implementing partner cost and other costs related to supply chain management. So this was actually an extensive exercise. It was very comprehensive review that even involved a lot of modeling for us to come up with this decision. And that's why I think it's really important for us to explain to the public why we had to do this. So the reason we had to do this is really to have to be able to utilize the available funding to provide essential health services and not to interrupt the health service delivery in the country.
Okay, thanks for clarifying that. I was just wondering, for some of those health centers affected and the people affected, definitely there could be no, is there another way that they can be able also to sustain themselves? I really don't get the picture very well, how they are going to manage. What's the impact of the whole thing?
So with this modeling exercise, we actually did an analysis to see what will be the impact. So the impact we observed is that we're able to preserve at least health services in 95% of what we have been providing. So 95% of the health services provided will be preserved. For just to make it clear, we had a criteria. So we really wanted to make sure that we are not significantly disrupting health services. Our criteria was, we try to look at overlapping services. For example, if two health facilities are very close to each other, we made sure that we drop one. So the one which is close to the other, we dropped it. Secondly, we also looked at health facilities which are being underutilized, because we know our current situation, the context is difficult in some areas. We have some areas in South Sudan where access is a problem, either due to insecurity or access due to climate change impacts like flooding in certain areas of the country. So that was also another criteria we also used, you know, to say, since the facility is not really utilized, so we have a reason to drop it. And then the third, so these are the two reasons. The third reason was also looking at the because we looked at the number of people visiting the facility itself. Of course, that measured utilization.
That's a determining factor.
Yes, exactly. So those were the factors that really guided us in making the decision to say, okay, this health facility, since it's not really serving a big number of population, we can drop it, but the community can benefit from the nearest health facility.
So is this a temporary exercise, or is going to be for a long time? What's the long-term time plan?
Well, of course, it's just a temporary solution for us to be able to manage with the existing, with the available resources, you know, to keep health service provision going. But otherwise, we are still looking into other options, even with the partners, with our partners and donors. We are still looking at other possibilities on how we can be able to sustain health service delivery, including the government itself, because one of the conditions for this health sector transformation project was that the government was requested to make a contribution of 10 million, which of course the government could not meet, but we are still following up with the ministry.
10 million pounds or dollars?
US dollars, yeah. So we are still following up also on this, and also we are continuing to lobby with the government to really advocate for additional health financing, because I think for sustainability, domestic funding would really surface very well.
I think most of the population or the people affected in this scenario here are those people who are maybe in rural areas, or those who are less disadvantaged. So for their sake, who may not be able to understand why A has happened, why not B, or why B has happened, or why not C. So the term you are using is technical for a lay person like me. Can you do that in Arabic? Just briefly, to make people understand also, specifically those who are maybe affected.
Yes, let me try to explain it in Arabic.
Yes.
Yeah. لكل مستمعين بتاع اي راديو، انا الليله عايز اوضح لكم موضوع بتاع الليله. احنا طبعا دايرين نوضح ليه احنا ما قدرنا ندي سبورت ل 102 health facility. طبعا الهيلث سيرفيسز مراكز الصحيه، يعني خدمات الصحيه في جنوب السودان. طبعا في جنوب السودان الهيلث سيرفيسز اصلا الخدمات الصحيه كان بندي خدمات صحيه بواسط عندنا بروجكت اسمه هيلث سيكتور ترانسفورميشن بروجكت. فحصل هيلث سيكتور ترانسفورميشن بروجكت بقى ما عنده دعم كفايه، عشان كده احنا اضطرينا ننقص السبورت، يعني ننقص الدعم لمراكز صحيه اللي كان تحت هيلث سيكتور ترانسفورميشن بروجكت. فاحنا نقصنا ب 102 مراكز صحيه. فاحنا يعني السبب اللي خلانا ولا الكرايتيريا الاصلا احنا استخدمنا عشان نقدر نعمل دروب اوت لهيلث فاسيلتي هو احنا شفنا اذا في مراكز صحيه قريب بعض احنا اضطرينا لازم نوقف سبورت في واحد فيهم. نمرة واحد. نمرة اتنين برضو المراكز الصحيه اصلا يعني عنده issues تا access، يعني ناس ما قادرين يستخدموا استعمال حقه ما عالي، يعني ناس ما بيجوا فيه كتير، ناس بسيتين بس. فبرضو احنا قدرنا احنا اضطرينا برضو to drop those kind of health facilities. فعموما السبب طبعا بس عشان نقدر يعني بقروش البسيط نقدر نحتفظ بخدمات الصحية في جنوب السودان.
نعم.
فده سبب بعربي البسيط انا حاولت عشان اشرح لكم.
نعم. ده تكون اسمه من دكتورة هاريت باسقالي، هو طبعا من وزارة بتاعت القومي بتاعت الصحة، واشرحوا سبب يمكن في نقص بتاع خدمات بتاع الصحة في بعض من المراكز في جنوب السودان. طبعا انا متأكد بكلام ده في كل ولايات، مش
الكلام ده حصل في كل في كل ولايات. يعني في ولايات تانيين طبعا يعني زي upper Nile اللي عنده issues كتير تا access هم يعني mostly affected. لكن otherwise احنا عملنا exercise في كل ولايات.
نعم. انا شايفه في ناس بدأ دوغو تليفون، لكن في زوليني ورسوا رسالة اسمه Ulinyi Santo is saying good morning Mama Hellen and guest in the studio. I want to ask her about health service delivery of medicines. Medicines are coming very well, okay, but you didn't get any Panadol in hospital. What is really wrong? But is that question for you? So because anything to do with health, people are obliged to or free to ask any question that they want to ask. Okay, كده نشوف في ناس جدوا تليفون كلا نشيلو كارد يا هريت. أي ريدو. Hello.
يا سلام، صباح الخير يا ماما هيلن.
صباح النور، معنا منو داري من وين؟
أي معكم لارن متصل من مدينة واو وستن برغدال الستيت.
نعم.
اوكي، بنحييك ونحيي الضيفة الكريمة هاريت، دكتورة هاريت. هم فقط هم شغالين بالجد من أجل شعب جنوب السودان. أنا بس عندي سؤال بسيط بس لاحظ. سؤالي ماشي مباشرة البروجكت، لأنه بروجكت implemented is going on، لكن في too much delay بتاع incentive in those areas all. هو الناس مستقرين في حتة ما لو فيش إنه لأنه جري قاعد يعصر السنة اللي فاتت خش لحد السنة الجديد. فلي سؤال بتاعي هنا بسيطة وأنا بسلم على شديد. شكرا كثير.
نعم كده كارر لأنا اسمتك أنا قبل ما لقوا كويس.
كويس، أنا اسم تاعي مؤسس لورن.
أوكي شكرا. أوكي شكرا، لقينا اسمك. ممكن تجاوب له ونشيله تليفون تاني.
يا ما في مشكلة. شكرا يا موزيس، شكرا من أجل السؤال بتاعك في محله. وبرضو أنا ببدأ عشان نجاوب لك. بالنسبة لإنسنتيف، نعم كان في تأخير كتير، احنا اتأخرنا تقريبا 6 شهور لدفع إنسنتيف. فالسبب طبعا كان في تأخيرات شوية بالنسبة للبروسيسينج أوف فاندينج، وده أخذ معنا وقت شوية عشان كده حصل تأخيرات. لكن أنا برضو داير أقول لك يعني إحنا إنجزنا وقدرنا ندفع أتليست إنسنتيف بتاع 3 شهور. إن شاء الله يعني في أيام الجاية هندفع حق باقي 3 شهور تاني. فشكرا للسؤال ده. وبرضه في زول سأل موضوع أدوية. I think نفس الإيشو تاع أدوية ده was also related to delays, you know, in the disbursement of funding. We had some issues regarding the process, you know, processing of the funding from the World Bank to get to the donors.
It takes time.
Yes, so it took a bit of time. So that's why we had some delays, and but currently we are already progressing, expediting the process to get medicines to the health facility as soon as possible.
Okay, let me pick another call. Are you ready? Hello?
Hello?
Yes.
Yeah. I'm giving Jackson from Gumbo.
Yes, Jackson.
Yeah, I got your information about this health transformation. You look here, let us not have doubt. Since we are a government, the government should have seen into it that all the health facilities, health centers, and hospitals need to be addressed very well, because we knew very well in South Sudan, we are very rich in money, in any resources, in anything. Why should we leave our health units or health sectors without drugs? Why can't we make our priority, especially on drugs or the health of everybody? So I supported you that any support now for health needs to be stopped, because we are unable even to help our own self. What I need from the government itself, to go and sit down, look for the budget for the special on health services. This is more important. And secondly, if we can come to part of agriculture and other sectors. But I really support you that all these health sectors need to be stopped completely. The government should know very well. Every time we don't want to be supported.
Okay, thank you, Jackson. We got your message here. We got it already. Let me pick another call, then maybe you can react. iRadio. Hello? Hello, iRadio. The iRadio? Yes.
Yes, good morning.
Morning to you too. Who is calling and from where?
I'm Justin John calling from Wau.
Okay, Justin John.
Yeah. بس أنا بقول شكرا كثير لأنه كنا منتظرين برنامج زي ده لفترة طويلة من الزمن. بس أنا بقدر أركز سؤالي للدكتور القاعد في الاستوديو إنه هم ركزوا في إنه بنزلوا عناية للإنسنتيف من حال توقف اللي بيكونوا شغالين في فاسيليتيز في المستشفى. هل الإنسنتيف اللي هم جايين يجيبوا مثلا ده ينقصوا من الشهر واحد ولا من بداية بتاعت القروش مثلا هم بيجيبوه في فترة تدل مثلا كان 6 شهور تدل وخماسي جابوا 3 تدل 3. هل هم بيقطعوا من ال3 الفدل ولا هيبدأوا يقطعوا من شهر واحد؟
Okay, سؤال تكيوصله. هاريت ممكن تبيجوا قبل نفرين ده وبدك نقدر نشيله تليفون تاني.
طبعا السؤال الأول من جاكسون it's regarding the government to step in and really take its leadership, you know, responsibility in running the health of the country. I think he has a point here because currently most of the health services, of course, we are supported by our donors. Our health budget is really, you know,
it's
not
mostly coming from outside.
Exactly. So we really want to push to get more domestic funding to support health service delivery, because health is a national security, and it's really important that the government, you know, really takes the upper hand in supporting health services in the country. And this is still our cry to the government. Let the health budget be increased. Sure. Let at least, if we can reach, even if we don't reach the 15% Abuja declaration, if at least we can go to a certain percentage whereby the government itself can be able to procure items like medicines, you know, as its contribution, you know, to health service delivery in the country. So this is our cry that our health budget is increased in South Sudan.
This is more like taking ownership of your own.
Exactly. Yes, yes. Because the health of our people is really our responsibility. It is our responsibility. And for Justin أنا عايزة أوضح لك بالنسبة لإنسنتيفز. طبعا إحنا دفعنا 3 شهور الأول وهندفع 3 شهور الجاي. So ال6 شهور الفات ما هيكون فيه reduction. إحنا ما هننقص الانسنتيف ده because ده حق فترة الفاتت. الامبلمنتيشن تا adjustment للبروجكت ده هيبدأ من شهر 1 2026. So any plans أي plan الكنا عندنا before شهر 1 26 هيمشي زي ما هو. So incentive الجاي بتاع 3 شهور ما هيتنقص. لكن أي incentive من شهر 1 لقدام هيكون هيتنقص من yes, it will be affected. Yeah.
نعم نشيل تليفون تاني. I read you. Hello, مرحبا. Hello. Okay. I read you.
كيف يا هلن؟
تمام.
ده سليمان من هيدراوة.
مرحبا بك.
شكرا للضيف بتاعك اللي في الاستديو. أنا داير كلمة you are most welcome our guest inside the studio of iRadio. But أنا sometimes get surprised. What is meaning of independent if we talk about we are independent country? Because كنا نقول أننا independent we have to depend للسلف بتاعنا إحنا كدولة. لحد 200 إحنا بنكون عايزين دعم من دول البرة. In the time that we have resources in this country, we're supposed to support other country المنو resources. يلا أنا أقدر نعرف ميزانية بتاع وزارة الصحة دي كم؟ لأنه عندنا وزارة الصحة بتاع جنوب السودان في الدولة بتاعنا هنا وفي ميزانية كل سنة قتالها. ميزانية دي كم؟ لما حتى مستشفى جوبا ما عنده دواء ولا في بنادول في مستشفى جوبا. قيافة ببرة لكن بجوا هناك شن. Thank you.
Okay, سليمان ناس مصرتك كمان لمرة الثانية. I read you.
السلام عليكم. صباح الخير. Good morning.
Good morning to you, Batista.
باتيستا أرمانو.
مرحبا.
أنا بشكرك وبشكر ضيف بتاعك الكريمة الدكتورة هاريا في استديو من أجل برنامج. وأنا بتمنى لهم التقدم والازدهار في البرنامج ده ما يكفي بس في كلام اللي قالوا ده وبعدين يكون ما في حاجة لقدام تاني بعد الكلام ده. أنا بتمنى يتواصلوا طوالي بالكلام ده ولو في طريقة يقدر يزيدوا ينموا زيادة وزيادة يطوروا زيادة وزيادة عشان الناس كله تقدر تستفيد منه وخدمات بتاعه مفيد طبعا لكل الناس. وانا ما عندي له سؤال. انا بس اقدم له صوت الشوف وان شاء الله ربنا يوفقه في ايامه القدام في كل المحافل اللي هو بيقوم بها الخدمه بتاعت الوطن.
شكرا لك باتيستا أرمانو. لسه كده أنا كمان أشوفه للرسائل. Mariel, you're accurate. You all is saying I'm watching you live from Rumbek Health Science Institute. My greeting to you in the studio. Confucius Joseph D. Tombe is saying I'm watching live from Ministry of Health and many thanks for such an insightful information, please. And Christopher Bago is saying Pasquale Harriet, thank you for sensitizing us through IE radio. And yes, I didn't read this. Garang Kolmakech is saying he's watching from Nemule border. Thanks. Keep your messages coming. IE radio.
صباح الخير ماما هلا.
أهلا وسهلا يا جوليا.
صباح الخير كمان دكتورة هاريت.
نعم.
أنا سؤال بتاعي كده دكتورة أنا داير أسأل طيب الباقي المراكز ما في يكون في سبورتنج ده بيكون كيف؟ لأنه ديل كلهم استاف تبع حكومة. ديل بيكون مشكلة بتاعهم شنو؟ لأنه شنو بعدين الروح بتاع شغل شنو بينحبس لأنه هسه مواهب ما في. ده أنا داير سؤال ده تتوضح لأنه في مراكز هنا تجيبها هنا ذاته من ضمن في مركز في الصروليوم ده كله ما عنده سبورتنج. هسه جرى لثلاثة إيه ما عنده أي سبورتنج. وفي مراكز كتير يعني هم بيشتغلوا. هل بيكون كيف؟ إنتوا كان ياو جل بتاع وزارة الصحة إنت كبير بتاعهم كده وضح لنا كلامنا.
نعم. شكرا جوليا. كده نشيلوا تليفون تاني وبعد ذاك دكتورة هنا بقدر يردوا لي تكون أي راديو.
صباح الخير.
صباح النور مرحبا.
سعيد من واو.
نعم سعيد.
بس أنا كنت دار أشارك بس بالفكرة ما سؤال. الجهاز المسؤول وزارة الصحة في زمن الدولة مرة بأوضاع خارجية ما في مرتبات، حتى عالميا في تذليل إن الدونرز ما قاعدين بدعموا القطاع الصحة. تقريبا يستوعبوا الطلاب الجامعيين في حقل صحي بطريقة كده ويوزعوهم في المراكز الصحية بعد ما التدريب بتاعته عشان يقدر يستفيدوا منه من خلال العمل بتاعته قبل ما يخرجوا.
اوكي صار نلوز ده منو ده سعيد من واو وكان ما تي مكالمته لكن قالوا بيسازوا ضيفوا فكرة لكن كان ما سؤال ممكن تبي جواب لجوليا شايف تليفون شغال جد
اوكي انا indeed need سؤال في سؤال من سليمان. طبعا سليمان عايز يعرف البادجت هيلث ذاته كم. وطبعا بادجت هيلث عندنا حسب معلومة الحسي with the new budget احنا health is approved for 1.3% of the total national budget. ده هو فيجا عندنا طبعا so ده له شوية إصابات كده. I don't have the exact figure لكن it is 1.3%. So 1.3% of the total national budget is allocated for health. Yes, for health services. So أنا ده إجابة حقي ببساطة. ولجوليا برضو أنا بشكرك الأخت جوليا لسؤال بالنسبة لمراكز صحية ما عنده دعم. يعني شنو بحصل؟ أول فأول أنا داير أوضح بإنه يعني مراكز صحية ده كله تعبين لنا. ده المراكز صحية حقنا حقت حكومة. فحتى لو منظمات ما أدونا دعم في مراكز صحية عندنا كوادر في مراكز صحية دي. وكوادر ديل طبعا كلهم ستاف بتاع حكومة وكلهم تهدمهية بتاع حكومة. فإحنا ما هنكفي المراكز صحية. ما في مركز صحي هيتقفل. فأنا بس عايز أكون واضح جدا جدا في حتة دي. إحنا ما هنكفي يعني شغل لسه هيكون في مراكز صحية. وإحنا دورنا كوزارة صحة إحنا هنحاول نفتش ده من حتات تاني. يعني حتى لو لقينا دواء مثلا نودي في مركز صحي اي نوع من سابورت بيمشي. لكن ما هيكون يعني سابورت من الهيلث سيكتور ترانسفورميشن بروجكت اللي هو هنا ده البروجكت الحاسي تاع وورلد بانك الماشي.
نعم.
فبس انا داير اودي اي زول لازم يعرف بانه ما في مركز صحي هيتقفل. يعني الشغل بيكون فيه لكن طبعا ما بمستوى اللي احنا دايرينه عشان ما في دعم كفايه.
نعم. ده سؤال تا جوليا ان شاء الله تقاسمه كلا نشيل يمكن تليفون واحد عشان كمان نبقى قريبين لنهايات. اي راديو. هلو مرحبا. اي راديو. هلو يا زول ما اسمع ممكن تبي تقول انا سريع كان زول ده هيكانا انا ممكن كمان بيشيلوا تليفون سريع زمن بقى قريب انتهى. اي ريلو. يس.
الو ماما هيلن.
يس.
بيتر ياب من أطلبرا.
يس بيتر.
زمان أنا بنشوف يعني الوزارة التربية لو يعمل تأمين. يعني زمان في حاجة اسمه تأمين. كل الناس بيعملوا نفوذهم وكل شهر بيشيل حاجة بخطه. والحاجات دي كان في يعني بدل من برا ما نشيل من الناس ذاته. يعني كل بيت يعمل نفسه يعمل نزل يعني لو في 10 ولو واحد دفع 3 كل شهر ما في حاجة زي ده. عشان ده بوفر دواء في مراكز.
Okay, shukran. Kalamta insurance hinak. Kalan shiluda. I radio. Tebe kun akir mukalama.
Okay, thank you very much. Mama Helen. This is Moses again back. Actually, I need to start a question. Since like Dr. Harriet has not answered one even. I was saying, since it is a project, why is it there is so much delayment? Even essential drugs, they are not even provided. People are already tired in all of South Sudan. They are not getting used to the someone. This is number one. Number two, we have delayment with the incentive. That is why it is suffering. This is seriously. Otherwise, let her answer this. Thank you very much.
Okay. The ball is in your court.
Yeah, shukran. عندنا سؤال من بيتا ياك. بيتا شكرا شديد هنا بأيديا باختراع تجيبته ده. Health insurance, I think that is really important, and that should be our direction. That is where we should go, because if we have a health insurance scheme in South Sudan, it will save us a lot from donor dependency. So I just want to applaud his suggestion. Thank you for that. The issue of delayment, why incentives, drugs delayed in the health facilities. So the health sector transformation project is supposed to supply drugs and also to pay incentives on regular basis to the health facilities. I think I tried to explain, but probably it wasn't clear. What I would like to say is the reason was just the processes, of getting the funds disbursed took us longer than expected. So that's why we had all the delays.
Okay. That is all. So the questions are over. Yeah. So now, after hearing from the callers, and also what would you like, what message or what would you like, what point would you like to get across to our people, those listening to you right now, because this is the last thing.
Thank you very much, Mama Helen, and thanks to all the listeners. I think those were very valuable questions. To conclude my statement, my message to all our listeners out there regarding the support, the cutting of support in 102 health facilities and reduction of support in 6 health facilities. I just want to inform the listeners, the communities out there that this is not to cause any panic in the community. The Ministry of Health and the donors are still committed to ensure that essential health services are always available to the people of South Sudan, and we will continue to work with our donors, to work with the government to make sure that we are able to mobilize additional resources to look into other funding streams to continue to to support health service delivery in South Sudan. And thank you all. Thank you, Helen.
Thank you so much, Dr. Pasquale. And that also brings us to the end of this morning's or today's edition of the Dawn program. And the guest with me in the studio was Dr. Harriet Pasquale, the Director General for International Health and Coordination at the National Ministry of Health. Thank you very much for coming to iRadio today and clarifying this very important issue. And also, I hope that every time we'll have this opportunity to have things clarified at the Ministry of Health, because people really need more information. And just to wind up, I would like to also convey my thanks to the Dawn team, that is Barry Johnson, the producer, Geoffrey Amanya, who brings us here every morning, Awan Moses behind the social media platform, and all those who have been listening to us and also participating actively in the program today, and those who are silent listeners and also following us online. Thank you so much. We'll link up again tomorrow morning, same time, 6 to 8 a.m. I've been with you, Helen Samuel. I hope you have a very fruitful day.